in Harrisburg. You're watching Pennsylvania's Fox News.
All right, well, you probably have seen them, or you may even have them. Varicose veins affect more than 30 million people. A lot of that people are mainly women. So this morning we're talking about when that nuisance on your leg can turn into a danger to your health. This morning we're joined with Dr. David Calcagno. I've been practicing. I told you I was going to mess up. Calcagno from Calcagno and Rossi Vein Treatment Center of Mechanicsburg, along with patient Linda Yingling. Good morning, Dr. and Linda. Thank you so much for coming in.
Thank you for having us.
Okay, doctor, we're going to start with you. A lot of people are maybe looking at their legs at home. I may have varicose veins, I may not. When does it become a health issue?
When varicose veins are large, it usually indicates that the underlying valves are not working. So instead of the blood returning to the heart through those veins, it's actually going backwards down into the leg, which can increase the vein pressure. It's this increased vein pressure that causes pain and swelling and can considerably interfere with the patient's activity levels. Vein disease is progressive. It's not going to go away on its own.
Okay.
And in severe cases may cause skin changes or ulceration. So I would say varicose veins are a health issue when they become associated with symptoms of tiredness, heaviness, swelling.
Okay, and Linda, tell us about your story.
Okay, well, Kirsten, I had a very large varicose vein, and it went from below my knee all the way down to my ankle on my right lower leg, and I had it for many years. Being a nurse, I was on my feet 10, 12 hours a day, and I was wearing those very heavy compression stockings. Even so, I would go home at night, and my legs would be so tired, and I'd say to my husband, oh, my legs hurt so bad. So I've heard of this procedure, and it was a procedure called closure that would eliminate varicose veins forever. So I think I called his office that day and set up an appointment.
Which is fantastic. Doctor, how does this procedure work?
Well, venous closure procedure, which you just mentioned, is the major breakthrough in treatment of vein disease. Prior to that, the only thing we could do was a big surgical stripping operation in the hospital under anesthesia with a prolonged recovery. With the venous closure procedure, we can place a radiofrequency catheter in that backward flowing vein and seal it off. My partner, Dr. Rossi, and I routinely perform these procedures in our vein center under local anesthesia with immediate return to normal activities.
Which is great. So Linda, if people are sitting at home and thinking, you know what, I have pain, I have symptoms, I'm tired, I need to get this fixed, what's your advice to them?
Oh, my advice is to do exactly what I did.
And how do you feel now?
Wonderful. I'm walking, I'm doing 1 to 3 mile walks, I'm exercising. I can shop all day.
And that's important.
And I have not said those words, my legs are tired or my legs hurt, for 4 years since I had the procedure done.
Which is so fantastic to know that there is treatment and there are options out there for people who are living with this. But Dr. Linda, thank you so much for joining us this morning. We have more information, including a link to the doctor's website on our Facebook page and our website, fox43.com. Just click on the Morning News tab. Thank you so much for joining us.
Thank you for having us.